We'll begin firstly with that news about the vaccine. Unfortunately, that CSL won't be able to help with local production there. We're obviously going to be having to look for a new manufacturer if we want to do that locally. What does that mean for the vaccine situation here in Australia?
Well, there is some controversy at the moment about the AstraZeneca vaccine. We still don't know properly what its efficacy rate is. We know it's likely to be somewhere between 60 and 70%. But until we get those details, it's very difficult to make decisions about that. And we know even less about the Novavax vaccine. They haven't even completed phase 3 trials yet. So these are very early days. And I think these judgments about what can or can't be manufactured are way too early until we get these final phase 3 results.
Just on that debate then about vaccine effectiveness, obviously there has been a lot of discussion, particularly as you said, about the Oxford AstraZeneca vaccine and those concerns about whether we could get herd immunity. But how much, I guess, can it help with our fight in Australia against the virus?
Look, the AstraZeneca vaccine, even at 60 or 70% efficacy, will still help in the situation where there's a major outbreak. And with the new variants from the UK and South Africa, there is a chance that they will take hold in Australia and we will have major outbreaks. So without those variants, I would say that we should probably wait because other vaccines will probably have higher efficacy than the AstraZeneca one. But I think for the moment, I think we just have to wait patiently. We will vaccinate all our at-risk people with the Pfizer-BioNTech vaccine, which has got 94% efficacy, and that's 1/5 of the Australian population. And by the time that's done, hopefully we'll have the AstraZeneca final results out, and then a judgment could be made about whether it's sufficient.
If we take a look now at Queensland government, it's actually considering regional quarantine camps as opposed to the ones in Brisbane. What sort of things will they need to be considering as they discuss this option over the next couple of days? Because obviously there's things to consider such as, you know, more movement of people if they've been flown to regional areas, but also health systems in those regions should people need to be transferred to hospitals.
Look, colleagues and I have been calling for this for months and months and months now. So it really is a welcome sign that the Queensland Premier has decided to at least look at this as an option. To me, it makes little sense to have a quarantine station in the middle of a major city. And we have ample mining camps, we have ex-RAAF bases, we have Woomera, we have Christmas Island, we have many places where we could have quarantine. What's needed is, as you said, we need a decent runway so we can get planes in. We need decent health facilities, decent accommodation, decent catering. There's absolutely no reason why the government couldn't use the Australian Defence Force for most of these things. They are experts at logistics, they're experts at anything to do with disaster relief. They have quite a large medical, health and allied health troops available who could be used to, let's face it, they can set up field hospitals that can cover just about any emergency. So I think a lot of these questions about, oh, we have to have access to a trauma centre can all be handled without any problems at all.
Adrian, I also want to look at the situation in Victoria, the announcement today that those mask rules for indoor settings will be ditched except for supermarkets, public transport and indoor shopping centres. Also, there's plans to bring workers back progressively from Monday. Do you believe this is the right time to be doing that?
Yeah, absolutely. I mean, we've got fairly lax mask rules in South Australia. And when you've got literally no cases and haven't had for days on end, if not weeks and months, then it's not quite so important to have strict mask rules. And it's also not quite so important to have everyone work from home. So I think Victoria, with 8 days in a row now with 0 cases, South Australia has got many more than that. In places like Western Australia, for example, and Northern Territory, we can be far less strict in terms of these mandated restrictions. So I'm quite happy with Victoria's decision to do that.
Adrian Esmond, thank you very much for your time this afternoon.